Okay, so we'd like to welcome Cassandra Schneller, talking on the economics of eating well.
Thanks, Sarah. Hi. Okay, so I did the economics of eating well. I'm Cassandra, and I own Sacred Kitchen. I feel like the reason I did this as a project was because one of the biggest reasons we tend to hear as holistic nutritionists that people are unable to really support their health through nutrition is they can't afford it. And we hear things like, well, I have a family to feed and I have teenagers at home. And that's a little bit frustrating for me because frankly, you know, what better reason do we have to support our health and our family and our children? But
1 second, I'm sorry. Can we put this on?
Oh, sure. Sorry. Oh God, now I'm gonna lose it.
Recording. Sorry.
All right, so you know, virtually every condition that we have, metabolic disease ranging from gum disease, heart disease, obesity, diabetes, is a diet-related condition. And so some of the things I'm going to talk about today are what our standard American diet spending patterns look like, some of the detriments of having a standard American diet, and then I'll go through some of the diet-related conditions as well. And when I talk about these statistics, I'm not just going to talk about the financial aspect. There's also going to be some personal burden aspects as well that you're going to see. It's going to be nice and rounded. And these statistics that I give you, these aren't things that I've put together and added numbers because I wouldn't be good at that. It would be horrible anyways. But these are coming from entities that are beyond myself, that are the American Heart Association, the CDC, lots of things like that. So they're factoring in things like childcare, transportation, what kind of production loss it would be, whether you're at home, school, or work, if you're taking time off for illnesses, what the actual time takes to find a practitioner. So lots of different things involved in these numbers here. So keep that in mind, because when we see the dollar, we're just thinking what we're paying out of pocket. Standard American diet. So this came from Hungry Planet. They did a little project quite a few years ago and took pictures of, I believe, 24 different families around the globe and what it looked like when they went shopping for a week. And this is a typical American family here. So it's characterized clearly by simple carbs, tons of sugar, lots of those icky fats we don't diet, lots of things that are causing an abnormal inflammatory response. So we tend to eat lots of foods that look like food. They're food-like products, very high in the things that are non-supportive to us, very low in actual nutrition. And we're eating far, far below what the actual USDA recommends for fruit and vegetables every day. As a matter of fact, in 2011, 23% of adults said they ate less than one serving of vegetables a day, and 40% of adolescents. So here we have 1998 to 2000. USDA tracked grocery store patterns, found that we're obviously underspending on the things that are very supportive to our health and overspending on these processed foods that tend to create metabolic disease and dysbiosis. And that overall, we've got 90% of our food income being spent on industrialized foods. That's an enormous amount. Oops, you see. I also found this fact pretty interesting, that 50% of consumers found it more costly to eat healthy foods, but we're averaging 4.5 times eating out per week. And that's for those of even low socioeconomic status. 4.5 times a week. So we know that eating out is not economical. Okay, I think even the people who are generally doing fast food and those things on a very consistent basis know that it's not economical, but choices tend to be made for different reasons besides nutrition. So we've got things that are coming in like convenience comes in, lack of education comes in, how detrimental this actually is when we make choices like this. I'll go into that a little bit more into detail, but In specific, fast food chains, for instance, are using some of the absolute lowest quality ingredients that they can source. And they also contain very unhealthy fats. They're full of excess sodium, excess sugar. The trend of eating out is on the rise. It's not going anywhere. Even for families that state they can't afford to eat healthy. So in 2014, the USDA also did another survey that said we're spending 50% of our food income at food establishments. So, fast food facts. I kind of feel like Steve Harvey with this presentation because there's just so many numbers. So I got, this is what I assume is the average, fast food places where most families are eating at, most of the time. These seem like the most popular to me. I don't know. You guys don't eat there. You guys don't eat there, right? So Taco Bell, this is for a family of 4. 2052, McDonald's 1888. I don't need to read the numbers. But so every single one of these estimates for one single meal to feed a family of 4 exceeded what the USDA says on a low-income family spends for a whole entire day, which is about $21. So when I started looking at this data, I have to say that I was shocked for a number of reasons. One, because most of my information was coming from government entities, and I didn't expect that. I feel like, we've kind of got this, it's like this looming government thing and doctors here, and they're really scary because they are out to make a profit. It's profit-run business, and the Americans' health are not in the best interest. But I found that this information was really easy to find, so if somebody's willing and wanting to learn, it's out there. I also looked in quite a, SNAPS is the current WIC. I'm not sure if you guys know that. That's what WIC is called now. It's the Economic Research Center showed that the benefits were well below dietary guidelines and that they were actually able to afford the fruits and vegetables that were recommended by the RDA, but they simply chose not to. So one of the patterns I saw emerging was that even if a family's income rose, there was no correlation in what they were spending their food income on as far as supportive foods, vegetables, fruits, grains, high quality products. So besides being a poor nutritional habit, clearly, and a poor spending habit when we're spending money out to eat all the time and we're buying processed foods, it really translates to poor nutrition. Tied up here. So this is when we start to see nutritional deficiencies. We're seeing metabolic disorders start to rise because the long-term results are diet-related disease. So I want to go over some of this is a nice chart that you actually can read. What's funny is I was watching your video that you sent us of what your presentation should look like, and I actually included a slide that you could not read it all. It was full of so much information because I thought, God, that would just be hilarious. But this one you can actually read. So so this is the USDA's chart for spending patterns on all these different types of food. And so yellow is the recommended, and then blue is average for U.S. households. So when we get down here, these tend to be the things that we don't want to see. So sugar, candy, frozen, refrigerated, and beverages, which far surpass what they recommend. And then we're clearly not getting much at all of what they say. Hey, look at dark green vegetables, the second down. So sad. So diet-related disease, and I covered just a couple because the CDC recognizes some types of cancer too, let me clarify, not all, as diet-related, and to just keep in line with what we're talking about and to make the statistics average appropriately, I'm just going to stay in line with these particular ones. As holistic nutritionists, we know we can pretty much pinpoint nutrition into just about every single condition, but I digress. And so I thought this was Jamie Oliver is a cook, a pretty famous cook out there. He talks about how homicide is 0.8% of deaths in the United States. Diet-related disease is over 60%. but nobody talks about it. Just take the F-bomb out there. So, oral health, hold on, back step. Almost half of Americans have one or more diet-related disease. That means it's costing our country $840 billion, which is a huge number, and it really doesn't mean anything, right? When I see big numbers like that, I'm like, okay, great, I have no idea what that means. Is that what we spend at the doctor's office? So this right here, this chunk, is what I meant when I refer to seeing some financial and personal burdens. So we're looking at the other aspects besides what your insurance may not cover. What did you have to pay for a copay? But what did you have to do for childcare? You know, what did you have to do when you took time off work? What's that quality of life looking for now when your joints are so sore and you're in so much pain that you can't play with your grandchildren? Dental health, I'm going to go into first. This is Weston A. Price. We talked about Weston A. Price a little bit in one of our previous classes, so just a little recap. He was a dentist born in the late 1800s. He really pioneered the theories that nutrition was directly related to dental health. So different things popping up when primitive tribes were being exposed to a modernized diet, so the different flours and sugars, and he was seeing dental caries, malformation of the jaw, narrowed palates, immune suppressions. So oral health is obviously a huge component of our overall health and well-being. And not just that, our smile is really, it's a huge part of us. It's one of our biggest assets. So if we've got malformed teeth and we have issues with speaking, for instance, just difficulty interacting, all sorts of emotional issues are going to pop up too. If we're not feeling comfortably socially because of our smile, this can go downline to other things like depressions and difficulty being out in social situations. So actually, I can give you a great example. So this is my second set here, Huper. I had them when I was 13 to 16, and not because I was born with a narrow palate or anything, but because I sucked my thumb till I was 12 years old, so that'll do a number. But I decided to get them now because my permanent retainer broke about 5 years ago, and I was experiencing so much spacing that every time I would go to dinner or eat, I would get just tons of food stuck in between, and it was really starting to affect me, honestly. I didn't want to go out to dinner with anyone anymore. That was not on my social calendar. Dinner, nope. Let's do something about it. You want to go for a walk in the park? So I get it, and I can only imagine, especially if somebody is in chronic pain from these kind of conditions. So bacteria from the mouth can obviously transfer to other parts in the body systemically and cause inflammation. There's been several reports of death that come from abscessed tooth that have traveled to the brain, and the chronic physical pain sometimes that people experience from death and other conditions is actually one of the top reasons for suicide in our nation. It's kind of this hush-hush thing. So I took some numbers from what that, if you have dental insurance, what that may look like. An average dental plan, biannual cleanings are covered 100%. One full set of X-rays is covered 100%. Up to 80% cavity correction, and then up to 50% on extractions and some other more serious things. So extractions, for instance, 80% of the population has to have removed overcrowding. So this kind of goes back to Weston Price saying that we experience malformations of the jaw and we get to see this narrow palate and teeth just start to overcrowd. We don't have enough space anymore for all the teeth that we're supposed to have as primitive people did. I feel like most people understand that when you're not brushing your teeth and you don't take good care of them and you're eating excess sugar, it will translate to poor dental health. But what we don't realize is that we transfer this blueprint of poor poor dental health and dental disease to our children in utero when the parents decide to pick up a typically standard American diet. %40 of us have expenses beyond what our insurance pays for, and that average was $319 a person per year. So again, just thinking back to, did you have to get a babysitter? Did you have to, drive 30 miles to see your doctor that day? Instances like that. Also, the time it takes to find a provider, exhausting. God, it's like one of the worst things ever. Oh, are they in my network? I don't know. Do you have the forms? Who should I call? So, 2012, CDC shows that 18% of children 5 to 9 have untreated dental caries, and 27% of adults 20 to 44. So, why? Why aren't we getting our teeth checked? Why aren't we going to the dentist? Well, in our country, we're not required to have dental insurance. We're required to have medical insurance. So a very large percentage of us do not have. As a matter of fact, 44% of us do not have dental insurance. So when we're experiencing issues, many of us opt out of going or just getting your regular checkups because of affordability. That's the main reason. Those without regular dental care experience more extractions. They tend to that they're the highest population who has dentures, and they're less likely to get any sort of restorative care or address actual gum disease. And the Academy of Dentistry, I have to read these statistics, so I can't remember all these numbers. So those without dental benefits report higher incidence of other illness and are 67% more likely to have heart disease, 50% more likely to have osteoporosis, 29% more likely to have diabetes. And I thought it fascinating that there's 51 million school hours lost each year due to dental-related disease. And I'm just thinking, these poor kids, I'm fine. Orthodontics. So I just talked about that a little bit. I'm a prime example. 4.5 million children and adults are going through orthodontic treatment in the States, which is quadrupled since the 1960s. So obviously there is a change there, and maybe it can't all be related to nutrition, but I feel like there's definitely some correlation between what our diet looks like now and what the parents are eating when they are deciding to have children, and eating while the children are in utero, and what that is translating to. I feel like when I was a kid and had braces the first time, there was a handful of kids that had braces, but now I feel like every kid has braces. Anybody else have braces? You do? You guys all had it too? Okay, I'm just making stuff up. But I feel like literally all children have braces now, and it's just this thing that you do. So the impact of oral disease is not confined to the mouth. It has these interactions with other body systems and associations between heart disease, lung disease, diabetes, stroke. Also, I found a lot of incidents that is linked to preterm low birth weight as well. So we'll get into some of the other super fun diseases. Diabetes. I'm going to let you guys just take a look at these numbers for a second. They're astronomical. And the one that really struck me was the one on the bottom. And just so what does the average person's medical expenditure look like who doesn't have diabetes, and then someone who does, and what they are spending out of pocket. So in 1990, the CDC said that there was a 61% increase in diagnosed diabetes. Largest part of these expenditures for these numbers right here, anyways, medical expenditures, so it'll be things like hospital visits, physician appointments, the actual anti-diabetic agents like your metformin, insulin, and your test strips, those kind of things. So we'll get into sugar and how that's increasing this epidemic of diabetes so much, and it contributes to anxiety, depression, hyperactivity. We will get into neurological disorders in just a little bit here. Increases risk of blood clots, strokes, fatty deposits in the liver. So those are all cardiovascular things. Diabetes, weight gain, hypoglycemia, kidney damage, oral dysbiosis. So sugar's in everything, and we know that here in this classroom, but I don't feel like the general public really knows that. The general public doesn't know how to read labels. They trust in the food system still. And the 2017 estimated revenue for the sugar industry is $97 billion. So this is not going anywhere. It's not going down. We're just seeing an astronomical jump on our consumption. So the sugar industry is starting to be compared to the big tobacco industry of the 70s because of their sort of smoke and mirrors tactics and marketing in the way that they're trying to keep the public from understanding the real deficits of what's happening. This is based on a 2,000 calorie a day diet. So I have two different numbers for you. Both of these numbers come from the American Heart Association, but the USDA says 50 grams or less a day. That's for men and women. American Heart Association recommends 24 grams for women and 36 grams for men. And that's kind of hard to equate sometimes, but it's roughly 100 calories and 150 calories. Of just, you're just going to eat whatever that day of empty calories. So average sugar consumption, though, for Americans as of 2016 is 94 grams. So an example, an 8-ounce serving of Lipton iced tea, the real friendly guy in the glass bottle. You're like, oh, I'm gonna do something good for myself today, man. I'm gonna get the iced tea. I'm not going for the Coke. 21 grams of sugar. Sweet. Literally. So, okay, cardiovascular disease, one of our favorites. So it's the actual #1 killer in the United States for adults, and second for children under 15. And I thought that was just horrible and so sad. So between heart disease and diet-related cancer, we're just going to say that, according to the CDC, it counts for almost 50% of our deaths. It's a really large amount. Obviously, we know the effects of sugar on the body, right? So the sugar comes in the system, and it creates havoc on the blood sugar, and we're releasing insulin, and the poor pancreas is like, oh God, I can't handle it anymore, and so we experience some disease process. So this I'm going to read as well off the paper. There's very clear correlations between sugar consumption and cardiovascular disease, but I found it super shocking that those who consume 21% or more of their calories in the form of sugar, and I'm just going to go back because 21% is not that much when you're considering here that this is calories and this is 150. So if you consume 21% or more of your calories from sugar, you're twice as likely to die from heart disease in comparison to those who get 7% or less. And then obviously we have the other things like the increase in LDL, decrease in HDL, which come into the whole cardiovascular picture. Neurological disorders, these, I'm doing the whole spectrum here, structural, biochemical, electrical. We know that long-term consumption of trans fats and sugars, these additives, all the things that are very non-supportive in the standard American diet contribute to obesity, diabetes, candida, memory loss, Alzheimer's. Alzheimer's, as a matter of fact, is so strongly linked to our sugar consumption that it's being dubbed type 3 diabetes. So clearly, when we have an individual, a family member that's experiencing these kind of disorders, it's more of a family disease. It is not specific to that person, right? Everyone has to support that in some way, whether that's taking them to doctor's appointments, time off work. We're oftentimes seeing loss of relationships, loss of jobs. Then we've got the stress impact, and the stress alone starts to cause physical degradation of those family members as well. So big picture, when we're talking about these economical costs. Trans fats, the reason I picked this one is because, again, most consumers don't know how to read labels. We know what this means. We know this means that there probably is something in there, so we're going to read the ingredients. But for the general public, this means, oh, I'm totally cool. I'm going to eat 16 servings of this because there's no trans fat in here. It says right here, it's 0. All right, so this is estimated economic cost for neurological disorders, that umbrella there. $236 billion was for Alzheimer's and other dementias. And under half is paid for Medicare. So the average that us as a family that we would be paying for grandma, mom to be taken care of is over $5,000 a year. Nutritionally speaking, we know that getting the proper amounts of omega-3s and the B vitamins, our amino acids, and all those things are really what's important for neurological health. And we're supposed to be getting our fatty acids from things like seeds and vegetables and high quality animal products. Obviously, our standard American diet isn't allowing that. It's triggering an abnormal inflammation process. So that's where we start to see a huge increase in what Kebby is talking about in ADD, ADHD, just neurological disorders in general. And children and adolescents that have poor nutritional uptake, but they also have digestive dysbiosis, tend to be extremely, extremely sensitive to those types of abnormalities. So we sort of have a double-edged sword there, because is it the digestion or is it the food creating the digestion? So the reality is not that you can't afford it. I don't know if any of you saw a trend while I was doing this research here, but so what I saw was that we really could afford to eat healthy, and that we were choosing not to. So it seems as though the real problem is a lack of education. People don't know what is real food anymore. They've got all these wonderful, super brightly colored, wonderful tasting products on the shelves, and that's food, right? I mean, why would they sell it to us if it wasn't? And if it didn't make us feel good and it was going to create a problem for us, it wouldn't be there. So there's the lack of understanding. There's also, we don't understand how crucial the choices that we make when we're at the grocery store and when we eat every day and within our meals really are to the health of our body. Whole body, soul, mind, physical, emotional. So in the United States, the average lifespan is 78 years. So wouldn't we love to be able to just get to 78 years and see our children grow up and play with our grandchildren? It's really hard to do that when we've got depression, when we've got brain fog, when we've got, explosive diarrhea, when we have super sore joints and we can't get on the floor and play with them. One of the first steps that we need to do is to create an awareness of the very distinct relationship that we have between food and our health. And it just isn't quite there yet. And I feel like another step is actually to teach people the importance of making that food at home. When we make our food at home, that's when we tend to see better choices. We start to see a little bit higher vegetables and fruits and grains. We have more control happening in our kitchen. So by choosing to put more money into your food dollars, you're going to see an overall reduction in the things we talk about: sick time, doctor's appointments, our co-pays, prescriptions, over-the-counter medication. Like I said, the just procurement of finding your different practitioners, that time it takes on the computer or those phone calls. And so Hippocrates said, food is thy medicine and medicine is thy food. Why did he say that? Well, because obviously when we choose more mindfully with our food, we're able to create a totally different environment for our body, and we're able to control and lower our risk for some of these other diet-related disease that we talked about. So we really can afford to eat healthier. I mean, that was my take off of this, which I was surprised about because I expected to be showing you guys what does it look like if a family of 4 who eats all great organic food from the farmer's market spend per month. What does it look like if a middle income family of 4, does what they can with a dirty dozen and clean 15, spend a month? And what does it look like when a family of poverty level spends with a family of 4 and just eating the standard American diet? That was really hard to do, but what I did was show you that even across the board, no matter what your income was, it was more about the education piece is where we're seeing those economics fall in. So we really can afford to eat healthier if we choose to eat wiser, and consuming a diet as close to nature intended is seeming like a greater cost at first, but there really is no higher value than the health of you and your family. The end. Questions?
My computer pooped out, so I'm trying to remember what to do with how much. Oh, $21 per day. Is that the USDA number?
Yep,
$21
and I
per
might
day.
have made a note on it because what I did for that average is they made it in two different averages. One was for 2 adults and children that were smaller. I think it was, infant to 9 years old. And then the other one was, 9 to 17 or something. And so I added those together and then split it up by the month. And that's how I got the number. But, where are you?
There it is.
Oh, there you are.
Did you see, and then later on you said that they recommend a certain number of fruits and vegetables within that $21? It was kind of extrapolating between those two together. That they just choose not to buy those.
Right.
So I was curious, within that $21, kind of how, is it the standard food pyramid that they're recommending people eat by?
Yeah, it's
Okay.
the My Plate is what they're using.
And they're calculating that on the low cost plan, you could eat on the food pyramid for $21 a day. That's what it's saying.
Yeah.
Interesting.
You mentioned something about suicide and I think dental issues.
Just
What was
chronic
that?
debilitating pain in general.
Okay.
But it seemed like what was consistently coming up for that was dental pain.
I see. And that led to, what was the kind of statistic that you mentioned about it?
To suicide.
Just to suicide?
Yeah, I think it was. Let me see what, well, Jamie Oliver said here. I think suicide related to diet-related disease is over 60%. Well, I guess that doesn't really tell us a whole lot. So I tried to go down that rabbit hole and really see what percentage of suicides were related to chronic debilitating pain that was related to diet-related disease, but it was so hard. So I just kind of steered away from that.
In all your research and things that you were doing for this, was there nothing where somebody compared standard American diet for a week for a family of 4 and somebody who shopped organic or grass-fed or anything?
Not really. No.
That would
And
be
so,
really great,
yeah.
And the comparison straight across the board, same family, whatever.
So,
And how much they ate out and all those things that you factored into. That would
Right.
be a really great piece of information to
Definitely.
tell somebody.
I think it would be really useful for someone like us to do
Yeah.
that because we have this great network here and we could ask, what Kevin, what are you spending a month? So I started to do that and asked friends. However, I didn't feel like I had enough people that were giving me their budget information that that it felt like you should know it, that it felt like supportive to what I was trying to talk about, you know. I
You almost
wanted,
want like have 50 families that would go.
no, and I think that would be
You know, or something
perfect.
like that.
Yeah, or even 20. I think even 20 would
And
be
there's
this
no
phenomenal.
research on
I
that.
couldn't find anything. So I really, when I started the thesis, or whatever, I keep calling it a thesis, but our research project, I'm like, it's a thesis. I'm graduating my master's, my thesis project. But I really tried to do that whole thing where I could see what people like us were spending a month and what people who were eating standard American and ask the questions and get those numbers. And they're just, the information is not out there for one, and to get it myself, it was so time consuming. And you know, to ask people like you guys to like, hey, can you look at your budget for this month and see how much you spent on food? You know, that's a lot for you guys to do too. So I felt like I was asking a lot of other people beyond asking extra work out of myself. And unfortunately, it's not out there yet. There's nobody else that I have found has done it. So there you go. Who wants a new project?
I mean, I'm even wondering too, like if you start up a practice and you work with clients that do eat that standard American diet, ask them what their weekly budget is, and then you swap them over to a more whole foods healthy diet, whether they can then also, you know, you start kind of keeping track of that and just see what the trends are. Because if you don't eat out so much and you're not buying all that packaged stuff, in my head I say it's almost as if good or cheaper to buy the whole foods organic grass-fed stuff. That makes sense to me. And it would be that way, because I'm not buying the sugary snacks and going to McDonald's or whatever.
What I started to see when I was asking the people who ate the standard American diet that are friends of mine to give me their numbers, it was really easy for them to give me their food budget numbers. What was not easy was for me to give them these other cost numbers. So what does your prescriptions look like every year? What does he pay for his diabetic treatments every year? What's your last time off school? So that was the other piece, that I could give you these numbers of what we maybe were spending per month, but what were we spending otherwise? Which was more of where the balloon of my project ended up being.
Well, I think that'd be awesome information to know.
Oh, absolutely. Yeah.
That combined cost in both areas.
And you know, I found that when I started eating better, I don't let anything go to waste.
Oh,
You know, before I started eating really, really high quality, I was throwing food away every single week. And so I feel like that's a part of it too. You're so much more mindful and you're paying attention.
You know, without going to the extent of surveying 100 people, you know, I just wonder, in order to have something kind of practical to hand to a client, when you're asking them to start purchasing whole foods, because there's a huge range of what you can spend. I mean, you can buy, you know, kombuchas in a bottle for every day at Whole Foods, and you know, you can choose to buy very expensive quality products, or you can choose to buy bulk oats and lentils, and you know, and so it's like, I just wonder about maybe even just kind of drafting like 1 week of a proposed Whole Foods grocery list, you know, and a cheap version of Whole Foods. I'm not saying Whole Foods Market, I'm saying.
Like there's a cheap version of that?
I'm not saying, I'm just saying a grocery list of Whole Foods that is, you know, a cheap version, and like price it out. And as like, here's an example of how you actually can eat real foods on a budget.
I would love that, because that was something I tried to do too. So okay, I'm going to get my groceries at Whole Foods this week. I'm going to get my groceries at Natural Grocers or Sprouts or Kroger this week, and just kind of do my own numbers. And maybe it would help to have a project in school where, you know, we have group presentations, and there is a group that does that. There is a group that gets the numbers for shopping a week all organically, and then there's a group that gets the numbers for shopping a week at the Standard American, and then we'll have this kind of collective data that maybe we can put together something like this, because I really had to narrow down where I was going with this whole thing, you know, starting in all these areas and feeling like I may have to change my subject too, is kind of where I thought maybe I was going to have to go. But then when I found more of this, more of what it looks like when you are long-term experiencing disease, not short-term when you're seeing that on your Wells Fargo account. So, yeah, it would be nice if I had help work 10 years and then I could get it to you. One or the other.
It's so relevant.
And it completely is.
So relevant.
Yeah.
Because everybody says it.
Yeah, exactly.
I can't buy my I can't get grass-fed meats and blah, 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 even if they knew where to get it. But if you factor all the things in that you pulled together for us today, it's total, it can never work.
Well, and you have to do it in
Less.
such a beautiful way when you point out to people where they're spending money so you're not insulting. You know, you can't say, well, how much did you spend on your cancer treatment last year? You know, that's just not, but in my mind, when I'm hearing that I can't really afford to eat that well or eat organically, I'm thinking like, you're 30 grand in debt because you had to get a hysterectomy due to cancer. So, you know, but you can't say things like that. So that's the other thing too. We're finding those numbers was getting a little bit hard with not being insulting.
You said something like, how would your financial situation be if you had been healthy for a while?
Yeah, I could have.
Something like phrasing it.
Totally could have said that. Yeah.
Well, it can even be as simplistic as, you know, you don't buy chips and you don't buy candy and you don't buy flour 1 week. And you use that savings of money to add it to organic foods and other things.
Oh, yeah.
It
So,
would, you wash or better or something.
I
And
can
that's simple, basic.
mm-hmm.
Yeah, even though we know all the diseases factored in there,
Yeah.
just having something to kind of educate clients with knowing this is.
Yeah,
this
real
is so much
cost,
money,
right?
you know.
Because,
Eat-
you know, the handout gives you some statistics,
Yeah.
but that's still not going to really mean a lot to the general public, you know? And so I think having some actual budget numbers would be really helpful. Well, I do have an example for myself, but it's not food related, it's related to medical costs. When I was in my 20s and was really depressed and I had those 4 years of trying to manage it, doing Western medicine prescriptions, I averaged my out-of-pocket expense to be at least $10,000 in those 4 years. So that means I could have had about $2,500 a year to put towards better food that was more supportive of my condition, and probably wouldn't have had that condition period at all if I was eating better. So that was just what I added up for myself too, like $2,500 a year I could have been getting all organic foods and grass-fed and
And that's how you tell it to your
Yeah.
potential clients, is this is what happened to me, and I got all this money, and then let them, think, oh, how much did I spend?
yeah,
Let them do it on their own.
yep, yep.
But I think it's getting cheaper and cheaper as the organic and pasture-raised and all those options are less of a kind of a luxury, considered a luxury specialty thing.
Mhm.
They're becoming more mainstream. The cost keeps coming down as well.
Mm-hmm. Yep. So basically what I just found is that people are just choosing not to even if they can afford it. They don't realize the importance of it, and it doesn't matter to them because their monthly budget is what matters to them. Their 10 years, 5, 10 year, 20 year down the road. That's not something they're looking at. You know, they've got the blinders on. So there's that too.
One more thought, sorry. Beyond, maybe not extremely low income, like not $21 a day, but when you're in that middle range, there's still the resistance of middle income families saying that I cannot afford
Yeah.
to purchase. And I think a big argument in that population is what you just said, is that priority of they probably, you know, have a car payment that's much higher than it has
Yeah.
to be, you know, like, but
Yeah.
it's a choice of I want my, you know, it's important for me to have a large TV in my living room. It's not important for me to have
Exactly.
grass-fed beef
Yeah.
on my plate. And so, you know, I mean, there's always, especially for that, especially when it's not poverty level we're talking about, when we're talking about people
Right.
who have a choice of what to spend their money on.
Right, yeah, and they just don't see the importance, and it's,
Right.
you know, well, I wanna have a really nice car, or I really like these kind of clothes, or whatever it may be, and actually, according to the USDA, luxury items are considered candy and pop and chips. That's what people are spending their money on, is these luxury items, right? I'm thinking a luxury item is a really nice new ring, but, you know. So, yeah, it's just really about perspective too, and someone needing to be ready to make the change before any of these numbers will even they'll care or they make any sense at all. If you're just telling this to your friend who drinks a liter of Mountain Dew every day, then I'm not gonna give a shit.
Or goes to Starbucks every day instead of making their coffee at home.
Yeah.
I mean, that's a huge, over time, that's a lot of money.
Right.
You know, especially if they're getting breakfast there as well.
Well, people really eat out 4 times a week during the week.
That was crazy. That was
That's
crazy. Yeah.
Crazy a lot.
Yeah. And I mean, that number included things like cafeterias too, in all defense, you know, so if we're talking about, you know, people that work at schools or in school or maybe in a hospital setting or something like that. So it's not strictly in a restaurant or a drive-through, you know. Those are the numbers.
I had a friend tell me he ate out pretty much every day at work just so he could get out of the office.
Yeah,
And I was
that's pretty
like, well, you
common.
could
Yeah.
just take your lunch and get out of the office and go to the park. He was like, I don't know if I could. I don't know if it would be that easy to get away if I'm bringing lunch instead of going out. To
Right.
get something.
I've had an office setting like that before. It was almost an excuse, like, I'm
Yeah.
gonna do this, and then you would bring food back for other people too, and it allowed you the opportunity, which is unfortunate.
People who go outside to smoke at work, they just like, they're like, oh, I'm gonna keep smoking so I can go outside. Right?